Welcome to my preliminary defense. I am Rahul. I work with Dr. Sankumali. The title of my proposal is ecogenic liposomes, and as the name itself indicates, these are the liposomes which are eco-generating, and we are trying to develop these liposomes for simultaneous drug delivery and ultrasound imaging applications. Last month I was reading an article in Pharma Times where they featured a study which has predicted that by the year 2017, 50% of men and 44% of women will suffer from cancer by the year 2017. And as we know, there are not too many drugs coming into the market to treat the various cancers we have. And whatever drugs we have, they suffer from two main limitations. That is systemic toxicity and drug resistance. And these two limitations can be partially overcome by or minimized by the use of vehicles, drug delivery vehicles like micelles, nanoparticles, liposomes, polymers. The good thing about these vehicles is that by changing the physicochemical properties of these vehicles, we can actually change the pharmacokinetic properties of the drug encapsulated. And among these vehicles, the most popular ones are liposomes. Liposomes are bilayer vesicles of phospholipid which has an aqueous interior in which they entrap hydrophilic drug. Liposomes have many advantages, and because of that there are many formulations in market which are approved by FDA. And there are hundreds of formulations currently in clinical trial. But the first formulation to be approved by FDA was doxil formulation, which are passively targeted, pegylated, multilamellar liposomes of free doxorubicin. Although doxil has reduced the cardiotoxicity associated with the doxorubicin, but these liposomes show some disadvantages, like its release mechanism is not known. There is no trigger to release the doxorubicin from these liposomes. And they have considerable side effects. Because these liposomes are pegylated, they are long circulating. They circulate in the body for longer period of time. And during that period, they leak out some doxorubicin and lead to side effects like thrombocytopenia, neutropenia, hand and feet syndrome. And their release is often slow, and because of that, it's often low. So how can we overcome these limitations? This can be minimized partially by the use of active targeting. That is, by putting tumor-specific antibodies and ligands on the surface of these liposomes to enhance the uptake by tumor tissue. But even after active targeting, we need some trigger which is specific to the tumor site so that these liposomes release the doxorubicin only at the tumor site. So for that purpose, we can employ either internal triggers or external triggers. Internal triggers can be oxidation, pH, enzymes, or redox. And external triggers can be temperature, ultrasound, light, or magnetic field. And because my proposal deals with the ultrasound trigger release, I will explain you a little bit more about ultrasound. Sound, as we know, is a mechanical wave. It is also called as vibratory wave, stress wave, or pressure wave. And the frequency of sound about 20 kilohertz is known as ultrasound. The good thing about ultrasound is that it can be focused, reflected, refracted, and absorbed by the material with which it interacts or through which it travels. And because of that, ultrasound has many applications in diagnostics and therapeutics. There are three important phenomena associated with the ultrasound: gravitational effects, thermal effects, and acoustic radiation forces. And because of these three effects, ultrasound is finding applications in drug delivery scenario. There are many advantages of ultrasound. The first one is it's an external technique, and that's why it's very inexpensive. It can be applied to a very small area of interest. As I told you, ultrasound can be focused, so we can apply it to a very small area of interest inside the body. Then its absorption by the body tissue is very less compared to the other energy sources, and because of that, it can penetrate deeper into the body. Then enhanced uptake of the drug, that is when we apply ultrasound to any tissue, it leads to a phenomenon called sonoporation, that is formation of transient pores in the cell membrane, and because of that there is an enhanced drug uptake. And the last one is the parameters of ultrasound. That is, we can fine tune the frequency, amplitude, intensity, different parameters as per our need for the different diagnostic and therapeutic applications. There are many applications of ultrasound, and some of those are approved by FDA, many of those in clinical trials, and many of those are in preclinical stages. And this image shows the ultrasound applications as a function of frequency. As you can see, there are two important regions, between 20 kilohertz to 1 megahertz and 1 megahertz to 10 kilohertz. Between this area, ultrasound is a very good ultrasound trigger because it leads to a lot of gravitational and thermal effects. But it's at the same time it's harmful to the body tissue, normal healthy tissue. And as we go above 1 megahertz frequency to 10 megahertz frequency, although ultrasound becomes safer to the body tissues, but at the same time its efficacy as an ultrasound trigger decreases. So how can we get the best of the two regions? A normal liposome is not ultrasound sensitive if frequency is in megahertz. Normal liposomes release the drug only with the kilohertz frequency. So what we can do to make a liposome to couple better with the megahertz frequency? That is by introducing some air or gas nuclei into the liposome. And when we introduce a gas or air nuclei inside these liposomes are called as echogenic liposomes. Depending on the location of the air inside these liposomes, there are three different types of echogenic liposomes. In the first one, the air is entrapped in the bilayer. In the second one, air is freely floating inside the aqueous interior. And in the third, a microbubble is taken on the surface of which liposomes are attached. And because I am dealing with the first kind of liposome, I will explain you the method to prepare it. The method is called as freeze-dry method. It's very similar to the traditional liposomal preparation method. That is liquid film formation, then hydration, sonication. The only difference here is that we are using mannitol as a cryoprotector. And why mannitol? Is because mannitol is a big cryoprotector. So during lyophilization, it does not protect the bilayer that effectively. So it leads to cracks and defects in the bilayer. And when we reconstitute these liposomes in buffer or in saline, it allows some amount of air to get entrapped inside, leading to echogenic liposomes. Then, in current drug delivery scenario, there are not too many reports of ultrasound drug delivery with simultaneous ultrasound imaging. There are no reports of dual triggers with the echogenic liposomes. So here we are combining an endogenous trigger with the exogenous trigger, that is ultrasound, to release the content from liposomes with simultaneous ultrasound imaging. And we are also going to combine different targeting and triggering strategies to these liposomes. So the overall strategy is to prepare an echogenic liposome so that it becomes sensitive to one of the endogenous triggers and ultrasound to get the release and ultrasound imaging. So these are my 4 specific aims, and I will go through each of them one by one. The first specific aim is preparation and characterization of echogenic liposomes for enzymatic high-frequency ultrasound trigger release in extracellular matrix. As we all know, matrix metalloproteinase is a proteolytic enzyme family which has more than 28 members, and they can virtually cleave all the components of extracellular matrix. They play an important role in normal physiological processes like angiogenesis, wound healing, tissue remodeling. But at the same time, they also play an important role in disease conditions like cancer and atherosclerosis. Their level gets increased by 10 to 20 times than the normal values in cancer and atherosclerosis, which leads to invasion and metastasis in cancer, and in atherosclerosis, they are responsible for plaque rupture. So here we are taking advantage of these elevated levels of MMP9 at tumor site to release our drug, specifically there at the intended site. So this is the concept of the study. So we are going to prepare an ecogenic liposomes which will have a MMP9 cleavable lipopeptide on the surface, so that when it comes in contact with the MMP9 cleaves the peptide and release the content with simultaneous ultrasound trigger, and we can have ultrasound imaging. So with this we started synthesizing a lipopeptide. This is the sequence of our lipopeptide, which has four GPO lipids, that is glycine, proline and glycine, proline and hydroxyproline. And these lipids are necessary to form a triple helical structure so that it becomes collagen-mimetic and get cleaved by MMP9. MMP9 cleaves between glycine and isoleucine here. We synthesize this peptide on CM Liberty microwave assisted peptide synthesizer, and we then conjugated it to stearic acid. This stearic acid part goes into the bilayer, and this peptide part sticks out on the surface of the liposome. Then after synthesizing the crude peptide, we purified it on HPLC using semi-prep column, and the purity was determined by taking multi-mass spectra. And after purification, we wanted to see whether this lipopeptide forms the triple helical structure or not. So for that purpose, we did the temperature dependent CD spectra. And as you can notice here, there are two peaks, one negative peak at 119 nanometer and one positive peak at 225 nanometer. And these are characteristic peak of a collagen mimetic structure. We also calculated the RPN value, that is ratio of positive to negative, and we found that it was very close to the natural human collagen. We also calculated melting temperature, which was found to be 49 degrees Celsius, which was very close to human collagen. This indicated that major fraction of our lipopeptide does exist in a triple helical conformation. After that, we started synthesizing this ecogenic liposomes with the same freeze dry method. And for that purpose, we took POPC and lipopeptide in 70:30 proportion. And then we checked the size distribution using dynamic light scattering and transmission electron microscopy. And as you can see, before lyophilization, the size was around 125 nanometer, but after lyophilization, it gets increased to 225 nanometer. Then after that, we wanted to see the ecogenicity of our liposomes. So we did scattering and ultrasound imaging experiment. And as you can notice in the scattering experiments, compared to control, the ecogenic liposomes were having around 20 decibel of enhancement in fundamental response, which indicated that these liposomes does entrap some air inside. And these scattering results were further confirmed by diagnostic imaging. This is the control sample, as you can see, is the completely dark. But when we add ecogenic liposomes to these wells, the wells start reflecting ultrasound, indicating the presence of air. Then after checking ecogenicity, we wanted to check the release with the MMP9. So we incubated these liposomes with human recombinant MMP9. And as you can see, with 1 micromolar of MMP9, we got around 20 to 25% release. And when we increased the concentration to 2 micromolar, we got around 60 to 65% release. The specificity of these liposomes we checked by incubating them with other proteolytic enzymes like MMP7, MMP10, and trypsin. But these enzymes failed to release the content from this liposome. Then after that, we exposed our liposomes to ultrasound to check the ultrasound trigger release. And as you can see, as the exposure time of ultrasound increased, there was increase in the release from these liposomes. After 3 minutes of application, we got around 20 to 25% release. After checking release with the individual triggers, we wanted to see whether we wanted to see the combination effect, like combination of the both triggers together. So for that purpose, we had 3 different setups. In the first setup, we added the MMP9 first, then after 1 hour, we applied the ultrasound. We got around 71% release with this setup. Then in the second setup, we applied the ultrasound first, and then added the MMP9. We got around 65% release. And in the third setup, When we added the MMP9 and started applying ultrasound immediately, we got very less, around 30% release. Then these release studies were done with the human recombinant MMP9. Then we wanted to check whether cell-secreted MMP9 releases the content or not. So for that purpose, we started growing different cancer cell lines, metastatic cancer cell lines, like HeLa, PANC1, MCF7, MC3, 22RV1. And we took the brain endothelial 3 cell line, which is a non-cancer cell line and does not secrete MMP9 as a control. And we collected the conditioned media after 3 generations. And as you can see, released with the media, which is in violet color. Brain endothelial media released less than 5% of content, whereas the metastatic cancer cell lines media, we got maximum around 50% of release. And this release was also further enhanced by application of ultrasound. And when we check the release profile with this media, as you can see, release was quite similar to the human recombinant MMP9, that is single exponential curve. And to summarize the study, we have successfully prepared ecogenic liposomes which have MMP9 cleavable lipopeptide in the bilayer. Then liposomes were found to be ecogenic both by scattering and imaging instrument. Then we got around 65% release with 2 micromolar MMP9. And with ultrasound application, we got around 10 to 15% of enhancement. And with the conditioned media, we got around 40 to 80% release. But with this liposome, we noticed one problem, that is the stability. Stability during lyophilation and after reconstitution. And we reasoned that it might be because of the lipid composition of these liposomes, that is POPC. As you know, POPC is having one unsaturation in the structure, and because of that, it has a kink in the structure, and because of that, it doesn't have the compact. It doesn't form a compact structure in the bilayer, and because of that, it leaks out the dye over the period of time. So in future, we'll be changing the bilayer composition of these liposomes. We'll be replacing some POPC with saturated lipid, and also we'll add some percent of cholesterol to increase the bilayer strength and increase the stability of this liposome. We'll also be adding pegylated lipids to impart the stealthy nature to these liposomes for the future in vivo applications. Then, after changing the lipid composition, we cannot expect these liposomes to behave similarly towards the triggers. So, we'll be checking the change in ecogenicity and release profiles of these liposomes as a function of change in the bilayer composition. We'll check the change in release profiles with ultrasound trigger, MMP9, and with the combination. Then moving on to the second specific aim, preparation and characterization of polymer-coated ecogenic liposomes for targeted cytosolic drug delivery and ultrasound imaging. In specific aim, first, the target was to release the drug in extracellular matrix. But here we want our drug to go into the cytosol. So how can we do it? So we can take advantage of differential thiol concentration in our body. That is, in extracellular spaces, the thiol concentration ranges from 10 to 40 micromolar, but inside the cytosol of cancer cells, it can be from 0.5 to 10 millimolar. And there are also many clinical reports where they have mentioned that the glutathione level gets increased in various cancer tissues compared to the normal tissue. So we are taking advantage of this differential concentration to specifically release the contents inside the cytosol. And for that purpose, we are taking help of disulfide bond. Disulfide bond is popular it's because of its reversibility and stability. Like, it will be stable in the extracellular spaces where thiol concentration is micromolar, but once it goes into the millimolar concentration of thiol inside the cytosol, it will get clipped. So the concept of this study is to prepare an ecogenic liposomes, and we'll coat it with the disulfide polymer, so it becomes stable in the blood circulation and extracellular spaces where there is a thiol concentration in micromolar, but when it will get exposed to ultrasound and millimolar concentration of reducing agent inside the cytosol, it will release the content with simultaneous ultrasound imaging. So for that purpose, we started synthesizing the polymerizable lipid that is POPG, which has 3 alkyne groups on the head, and we prepared the liposomes by the same freeze dry method with POPC in 1:1 proportion. After preparing these liposomes, we coated them with the disulfide polymer. So for that purpose, we did a simple click reaction with the diazide cross linker, which has a disulfide bond in presence of sodium ascorbate and copper 2 chloride. And the polymerization can take place within the same molecule of POPG, like this, or within the 2 adjacent molecules, like this. So the whole ecogenic liposome gets coated with disulfide polymer externally. Then after polymerizing, we check the sizes by DLS and DM. And as you can see, before lyophilization, sizes were around 17 nanometer, but after lyophilization, it gets increased to 117 nanometer. And when we took the TM picture, we could actually take the picture of liposome entrapping an air bubble inside. This is the air entrapped in the bilayer. And this is the aqueous interior of liposome. And the liposome size was around 100 to 120 nanometer. Then we check the ecogenicity of these liposomes. We did the scattering, and as you can see, compared to control, in fundamental response we got around 20 decibel of enhancement, and in second harmonic we got around 10 decibel of enhancement. We confirmed these results by taking ultrasound images. As you can see, control, which is completely dark, but after addition of liposomes, the well started reflecting ultrasound. Then after that, we exposed these liposomes to reducing agents, different reducing agents like diethylthioidal, glutathione, and cysteine. We took the concentration range from 10 micromolar to 5 to 10 millimolar. And this is because the 10 micromolar concentration represents the extracellular spaces, and this is the concentration of thiol inside the cytosol. And as you can see, the release increases with the increase in concentration of reducing agent. With 10 micromolar, we got less than 5% of release. But when concentration increases to 5 to 10 millimolar, we got around 80 to 90% release. Then we wanted to check the effect of the reducing agents on the morphology. So we took the AFM pictures, atomic force microscopic pictures, before and after treatment with the glutathione. We incubated liposomes in 5 milliliter of glutathione for 1 hour. And as you can see, before treatment, the liposomes were round and nicely shaped, spherical, with size around 100 nanometer. But after treatment, the structure looks disturbed and elongated, and liposomes get fused, indicating that the reducing agent, while cleaving the polymer, does disturb the bilayer and releases the content. Then after that, we expose these liposomes to ultrasound, but surprisingly, we did not observe any release with the ultrasound trigger. Then we applied the, when we added the reducing agent to these liposomes, and after 1 hour applied the ultrasound, there also we did not observe any enhancement with the ultrasound. The only setup where we observed the enhancement with the ultrasound was when we applied the both triggers together, like added the reducing agent and started applying ultrasound immediately. And there, we got around 10 to 20% enhancement. We got maximum enhancement with glutathione-treated liposomes, around 20% enhancement, then 15% enhancement with DTT, and around 10% enhancement with cysteine-treated liposomes. And when we started thinking about this, like why these liposomes are not responsive to ultrasound alone, then we reasoned that it can be because of the polymer coating, disulfide polymer coating, which is imparting strength to this bilayer. And only when the polymer gets cleaved partially by these reducing agents, it becomes sensitive to ultrasound, and ultrasound releases the content. To support this hypothesis, we did one more experiment where we took 2 different batches of liposomes, polymer coated liposomes, and their non-polymerized versions. And we applied low frequency ultrasound, 22.5 kilohertz. And as we know, this low frequency ultrasound is generally used to disrupt the cell membrane because it sends a lot of energy and it leads to high cavitation. So it literally disrupts the membrane. And as you can notice, at different time points, the release from the polymer-coated liposomes is always less than their non-polymerized version, indicating that the polymer coating does impart strength to the bilayer, and thus the polymer-coated liposomes are less responsive to their non-polymerized version. Then to summarize, we have successfully prepared polymer-coated liposomes, ecogenic liposomes, which were ecogenic with enhancement with 20 decibel of enhancement. We got around 55 to 76% release with 5 millimolar of reducing agent, and when we applied ultrasound together, we got around 64 to 96% release. Then in future, in these liposomes, we will be adding pegylated lipids to impart the long circulating nature to these liposomes for in vivo applications. And then we will be changing the bilayer composition, and we will try to increase the POPG lipid, that is polymerizable lipid, so that the polymer coating become more denser and the liposomes will become more stable. And after that, after optimizing the bilayer composition, we will check the serum stability of these liposomes. And after changing the bilayer composition, we will be checking the change in ecogenicity and release profiles of these liposomes as a function of change in bilayer composition. We will also check the effect on encapsulation efficiency. Then after that, as we know, most of the cancer cell lines like PANC1, HeLa, and CH7, they overexpress folate receptors on their external surface. So we will be targeting our liposomes using folic acid. So we will conjugate our liposomes to folic acid, and we will be doing cell uptake studies as a function of time, concentration, and application of ultrasound. Then after doing that, we will encapsulate doxorubicin into these liposomes. Doxorubicin, as we know, is a classic anti-cancer drug, and we will encapsulate this doxorubicin using traditional pH gradient method, where we encapsulate a acidic buffer inside in the aqueous interior, and we incubate these liposomes with doxorubicin. So doxorubicin enters into the aqueous interior, gets ionized, and gets entrapped. Then we will determine the encapsulation efficiency of this doxorubicin by taking absorbance of doxorubicin before and after gel filtration. Then we will be doing cell viability studies with these liposomes as a function of ultrasound treatment, folate targeting, and we will check the uptake of these doxorubicin liposomes by taking fluorescence microscopic images. Then moving on to the third specific aim, preparation and characterization of pH-tunable ecogenic liposomes for cytosolic targeted drug delivery to cancer tumors and ultrasound imaging. Microbubbles or the gas bubbles are generally used to enhance the contrast of a perfused tissue in ultrasound imaging. But these days, these gas bubbles are also finding their application in drug delivery and gene delivery, where researchers are attaching a drug carrier like liposome on the surface of gas bubble, and when they apply ultrasound, the gas bubble burst, leads to release of content from the liposome. But there are two problems associated with the use of microbubbles in drug delivery. The first one is their short half-life. They get dissolved in the bloodstream very fast, within few minutes. And extravasation, because their size in microns, they cannot extravasate through the blood vessels into the cancer tissue, and they cannot assist the ultrasound to increase the uptake of this drug associated with the liposome. So how can we circumvent these problems? That is by taking advantage of acidic microenvironment of tumors. As you all know, cancer tumors are characterized by rapid growth, and because of that, they need a lot of nutrition and oxygen. And if they don't get it, they produce a lot of lactic acid under anaerobic respiration and hydrolysis of ATP. And because of that, the pH of the tumor decreases slowly in the extracellular spaces. And there are many clinical reports which have shown that the extracellular pH can go up to pH 5, and the lysosomal pH of the cancer cell can go up to 4.5. So we are exploiting this characteristic decrease in the pH at tumor site to render our liposomes ecogenic specifically only at the tumor site with simultaneous drug release as well as imaging. So the concept is to prepare a liposome and encapsulate a gas precursor like ammonium bicarbonate along with the drug, anti-cancer drug like doxorubicin. So as such, we are not preparing an ecogenic liposome. This is a normal liposome encapsulating a gas precursor and doxorubicin. But when this liposome will travel into the tumor tissue or a lysosome of a cell where there will be a lot of H+ ions, hydronium ions, those H+ ions will slowly diffuse into the bilayer. And when these H+ ions come in contact with the ammonium bicarbonate, they will react with ammonium bicarbonate to produce carbon dioxide and ammonia. So the H+ ions will continue to diffuse into the bilayer, and at some point of time, internal pressure because of the production of gas will be so high that the carbon dioxide bubbles will try to escape through the bilayer. And while doing that, it will disturb the bilayer and will start leaking the content, specifically at the tumor site. So with this, we started preparing the liposomes by the same traditional method, liposome preparation method, and we encapsulated 0.4 molar ammonium bicarbonate in the aqueous interior. We checked the sizes by dynamic light scattering. We found size around 110 nanometer. And we ensured the lamellarity of these liposomes. And why lamellarity is important here is because the hypothesis is that the hydronium ions will diffuse into the aqueous interior and will create a sufficient pressure to disturb the bilayer and release the content. So if we use the multilamellar liposomes, the hydronium ion will have to cross multiple barriers, come inside and create sufficient pressure so that to disturb the multiple barriers. So our target was to prepare unilamellar liposomes. So we confirmed the lamellarity by taking TA picture, as you can see here. The liposomes are unilamellar. Then after checking the lamellarity, we wanted to check the tunability, that is pH tunability. So for that purpose, we incubated liposomes with different pH buffers from 7.